artery blockages. In patients with significant coronary blockages, creating bypasses using their own arteries or veins ensures sufficient blood supply. With this, their quality of life improves and they will be free of sudden heart attacks. CABG is indicated in blockages of all three blood vessels with depressed heart functions, with two blocks and sometimes with one block where PTCA or percutaneous transluminal coronary angioplasty has failed, and in patients with blockages after angioplasty. There are various ways of doing this major heart operation. One with the heart completely stopped and another without stopping the heart with the heart beating. This is called off-pump coronary bypass surgery. Here the advantages are many, though it is a bit difficult to do technically, and only a few cardiac surgeons perform these operations with ease. Advantages are very fast recovery, less bleeding, less respiratory and kidney problems, good wound healing, and less expensive as well. It is the method of choice in high-risk cases. Conduits, pipes used for bypassing the blocks. For coronary artery bypass grafting, various conduits are used. Arterial conduits are preferred because of their quality matching with coronary artery, long-term patency, size matching, etc. Most frequently, the artery to the left breast, the left internal mammary artery or lima, can be left attached to their usual point of origin and sewn in to the coronary artery beyond the point of blockage. The lima is the most common vessel used in this fashion and can be attached to the vessels on the front of the heart, the left anterior descending or a diagonal branch. It is considered as gold standard conduit because of its elastic artery nature. It can grow according to demand. It is resistant to atherosclerosis and long-term patency is highest, that is above 98%. Its counterpart on the right, the rima, can also be used for some branches of the right coronary artery. Other vessels, such as the radial arteries from the wrist, can be used just like the veins. Most often, veins are used, and most often these are from the legs, the saphenous veins. Sometimes from upper arms, cephalic vein. Finally, some vessels from the area of the abdomen, such as the gastroepiploic, inferior epigastric artery, can be used. Most often, mitral and aortic valves are affected by rheumatic heart disease or degenerative diseases. They can be either stenosis, obstruction, or regurgitation or leaking. Depending on the severity of the problem, either repair or replacement with an artificial valve can be done. This is a major open heart operation, requires heart-lung machine to stop the heart, and then open the required chamber to repair or replace the diseased valve. There are millions of people living with artificial valves leading a near normal life. The patients with mechanical metal valve needs regular health checkups and need to take anticoagulant lifelong to prevent the choking of the artificial valve. If tissue valve is used, they need not take anticoagulants. Disadvantages are that tissue valve may degenerate after 15 to 20 years. Post-operative period. You will be discharged home after 5 to 6 days and can resume simple household activities. Resuming proper duty is advised after 6 weeks. Few drugs like blood thinner and anti-cholesterol or lifelong medications, blood pressure and diabetes mellitus medication, and strict control is essential for better long-term result. Painkillers, antacids, bronchodilators, diuretics, laxatives are all temporary medications. Check up after a week and month than yearly. You can take a bath daily. It is better to use chest binder and elastocrape bandage on legs for 6 weeks. Avoid sleeping on one side for 1 month. Driving, jogging and swimming can be resumed after 2 to 3 months. Diet. If one knows how much and what to eat, he probably will not have any problems. Adequate and balanced diet is difficult to strike. Only source for cholesterol is oily and non-vegetarian foods. Eat a diet which will lower your cholesterol. Avoid excess sugars and salts. Eat plenty of vegetables, fruits and cereals. Exercise. Exercise is one of the most important aspects of maintaining health and weight. For improving your general health and lowering the risks of multiple diseases, getting a total of 30 minutes of exercise on most days of the week is the goal. This guideline allows you to accumulate the activity over the course of a day. 3 10-minute walks are as good as one 30-minute walk and usually easier to work into a busy day. The key here is to do some exercise regularly. If you can't do 30 minutes today, do 10 minutes of walking. Continue to work this most healthy of pursuits into your life. Risk factors. Persons with risk factors are usually at a high risk of developing heart disease. Hence, those with high risk factors should undergo periodic heart checkup to rule out silent disease. Modifiable risk factors. Diabetes mellitus, hypertension, smoking, hypercholesterolemia, sedentary habits, obesity, type A behavior. Non-modifiable risk factors. Family history of heart disease. The risk is higher in men. Diabetes and heart. Diabetes mellitus produces heart disease in many ways. Patients with diabetes are at a higher risk of silent heart disease. Hence, routine heart check is a must in every diabetic. Long-standing diabetes may lead to heart failure due to disease of the muscle. Diabetes increases the chances of producing blockages in the coronary arteries, leading to heart attack. Patients with diabetes may have silent heart attacks, and hence, even in the absence of symptoms of heart disease, all diabetics should undergo a periodic checkup of the heart. Hypertension or high blood pressure. Facts you always wanted to know. What is blood pressure? Blood pressure is the pressure exerted by the blood on the walls of the arteries. Your doctor always indicates your blood pressure by a set of 2 numbers. Example, 120 by 80 millimeters of mercury. What are these numbers? The upper one denotes the pressure on the arteries when the heart is contracting. This is called systolic pressure. The lower one is the pressure on the arteries when the heart is relaxed. This is called diastolic pressure. Remember, hypertension is very common. It is often without any symptoms. A few cases may have headache, tinnitus or ringing in the ear, giddiness and fainting. Hypertension is readily detectable. Usually, easily treatable. Smoking. Smoking or use of tobacco in any form is injurious to health in general and heart in particular. Apart from heart disease, smokers are at risk of developing diseases of the lungs, digestive system and urinary system, bladder cancer. Second-hand smoking or passive smoking is also equally injurious to the body. Smoking increases the heart diseases by the increase in oxidation products in the body which are harmful. Stopping smoking reduces the chances of developing heart disease. Hypercholesterolemia. Cholesterol is a waxy, fat-like substance that is present in every cell in the body. Some cholesterol is needed for our body to function. Bad cholesterol in the body increases by fatty foods, non-vegetarian diet, and sedentary lifestyle. Good cholesterol in the body increases by regular exercise program.
Prevention is better than cure. This very much applies regarding heart diseases because majority of the heart diseases are life-threatening, as we all know. According to the WHO, World Health Organization, they have predicted by 2020, one-third of the Indians will be suffering from heart diseases. It is going to be an epidemic in India. So it is wise to know how to prevent heart diseases. If someone knows about risk factors of heart diseases, then probably it is easy to apply these prevention techniques. Coming to the prevention factors, the most important is adopting lifestyle modifications. One has to take the life in an easy way. In the present era of tension-full life, one should know how to lead a tension-free life, at the same time achieving all his targets and goals. Then, next factor is probably diet, which we eat 3 or 4 times a day. It is very much essential, no doubt, but one should know what to eat and what not to eat, because diet is the one, in that mainly cholesterol is the one which causes all these atherosclerosis and coronary artery disease. So regarding this, most important is avoiding all non-veg foodstuffs, avoiding all foodstuffs which contain a lot of fat. So my sincere advice is stick to a vegetarian diet, avoid all oily stuffs, avoid all fatty stuffs, and have a healthy heart. Then next preventive aspect is smoking. Smoking is absolutely dangerous in any form. So smoking in cigarette form, BD, pan parak, gutka, in all forms is very dangerous. So my sincere advice is stop smoking today from this moment. Then regarding weight, one should have an ideal body weight. Obesity or excess weight is dangerous to the body because it affects your joints, it affects your bones, and it causes extra burden to your heart. So one should aim to have ideal body weight. Coming to other preventive aspects, if you have diabetes, one should know strict control of diabetes is very essential. This not only prevents heart diseases, it prevents diseases of your other parts of the body as well, like brain changes, eye changes, pancreas changes. There are so many advantages by controlling the diabetes. If one knows how to control his diabetes nicely, diabetes is not an enemy, diabetes is a friend. Then coming to the blood pressure, if one has a blood pressure, it's also like a diabetes. If one knows how to control it, it is a friend, one can live with it. Strict control of blood pressure, a regular checkup, regular medications are very essential to prevent heart diseases. Exercise is the most important preventive aspect of heart diseases. It's because exercise will help us to have a good physical health, good mental health, and good spiritual health. This will definitely prevent the heart diseases. As we all know, our ancestors never used to suffer from heart diseases so much because they were doing certain amount of exercises in everyday activities without their knowledge. With the present day of mostly a sedentary life, we all need to have some sort of exercises program every day. Maybe a jogging or walking in the park for 20 minutes or some sort of yoga exercises, meditation, all these sort of exercises will help us to have not only a good physical health, it will also help us to have a spiritual health, mental health, and it will help us in many ways. Then probably a clever decision regarding prevention of heart disease is to have a regular health checkup. Though we know several risk factors and how to prevent them, still many people can have heart diseases. The only way to prevent in this scenario is to have regular health checkup, especially at the age of 35 and afterwards. If somebody can have a yearly checkup like master health checkup or executive health checkup, wherein your entire body is tested for various diseases, it will be a nice idea. So I strongly suggest a person above the age of 35 or 40 years and with some risk factors should undergo a regular health checkup, though he thinks that he is totally healthy. Then probably the sincere most advice to all of us is to have some sort of health insurance, because though we know all these risk factors and prevention, still we don't know who will get a heart attack and when he will get a heart attack. When that happens, we all know all these treatments are quite expensive and majority of us cannot afford at a single go. So it is wise to have a health insurance, so that even if somebody gets a heart disease, in spite of knowing all these prevention factors and adopting them, in case we get heart problem, we know that we have a health insurance and we can have some sort of mental peaceness. So I strongly advise everyone should have a health insurance.
Modern lifestyle is hectic and demanding. By taking care of your heart, you can add miles to your life and smiles to your family.